Okay, hey, I'm Jordan Sutton, and the next test my group is given is the Pro Agility Test, and the title of my article is Lower Extremity Kinematics and Kinetics of Division III Collegiate Baseball and Softball Players While Performing a Modified Pro Agility Test. Okay, the authors are B.J. Wallace, T.W. Kernizek, and E.C. Bothwell. The article was published in a journal of sports medicine and physical fitness. This article stated that females experience at least twice as many non-contact ACL injuries as males. Okay, in American female college athletics alone, there are about 2,200 ACL injuries each year. The purpose of this study was to investigate if males and females exhibited different characteristics while performing a modified pro agility test. Okay, the participants of this study were Division III college baseball and softball players. These subjects were healthy and had no previous history of an ACL injury. The testing was conducted in the preseason, so all athletes were well conditioned. These were 14 males and 13 females, 14 baseball players, 13 softball players. The athletes performed 4 trials of a modified pro agility test. This consisted of running toward a forced platform target for 5 steps, planting their right foot and pushing off the target with their left foot. Kinematic and kinetic parameters were compared using a multivariate analysis of variance between gender. Kinematics were captured using the Cleveland Clinic marker set, which consists of securing 21 retro-reflective spherical markers on a combination of select anatomical landmarks and triads on lightweight plastic shells. Markers were placed on the left and right anterior, superior iliac spine, sacrum, posterior portion of each shoe, and one on each shoe near the toes. The triads were placed on the thigh and shin of each leg. Kinetic data was recorded during the stance phase of each trial using a Bertec force platform. Before the testing began, each subject's height and mass were recorded. Each participant wore the same kind of shoe, and this was the New Balance running shoe model 629. The uniform footwear was to control for different shoe sole absorption properties. There was a 3-minute warm-up on a Monarch bike at a self-prescribed moderate intensity. Before the testing trials began, the subjects were recorded in a standing anatomical position to set the transformation matrix between the local coordinate systems of the subject and the lab. During the test, participants ran straight toward the target, turned counterclockwise 90 degrees as they came within 1 step of the target, planted their foot on the forced platform, then propelled themselves back off the platform, again turning 90 degrees counterclockwise. Each subject completed 4 cutting trials. A 1-minute rest was given between trials. The results: females had a greater maximum knee extension angle and greater knee range of motion. Both groups reached the maximum knee flexion of 52% of stance. Females had significantly more maximum hip flexion than males. Females had a significantly smaller minimum internal knee varus movements. The female group displayed an external knee rotation angle during the beginning of their stance, which was significantly different than the internal rotation angle in the male group. To conclude, females displayed knee movements and kinematics that may place them at a greater risk for an ACL injury during a stop and cut task. The article states that females should be coached to perform stop cuts with more knee flexion and more neutral knee rotation angle upon foot contact in an effort to reduce moments that may put your ACL at risk of tearing or having an injury.